see the patient in the A&E, and if they think the patient can be treated at home without admission, that means they will give the medicine to the patient. You take this medicine, you can go home. There's no need to get admitted to the hospital. Go home. They send the A&E doctor sends the patient home. From the A&E department itself. That is not admitting. But imagine the A&E doctor see the patient in the A&E department, and they think the patient needs to be admitted in the hospital for the treatment. Then the A&E doctors will call the concerned specialist, where it is, medicine or surgical specialist. Okay, they'll say, okay, I think we have this patient. I think he needs to be admitted. He'll call this particular specialist. Then this particular specialist, SHO, will come and see the patient, and then they will admit the patient to the ward. And then once he recovers, then he will be sent home. That is discharge. So, as an SHO, can you discharge a patient? No. Who can discharge? Only consultant, or maybe senior registrars, very senior. Okay, so SHO cannot discharge a patient once he's been admitted. But whose decision is it is to admit or not admit the patient in the A&E department? Whose decision? Consultant decision? Registrar. Who sees the patient first in the A&E department? SHO. So that means whose decision it is? SHO decision. So whether to admit the patient or not to admit the patient, that is an SHO decision. That means as an SHO, you should know which condition requires admission, which condition does not require admission. You must know that as an SHO. Now, imagine there is a medical condition which required admission, but you did not admit the patient. You send the patient home. Are you a safe doctor? No, then you're not a safe doctor. Maybe the patient died at home. But imagine there is a medical condition which did not require admission, but you admitted the patient. Are you a safe doctor?
Yes. Maybe.
Are you a safe doctor? Or not?
Because you're admitting someone who needs to be admitted.
Either you gave them hospital-acquired infection, which was not necessary at all. If he was sent home, probably he wouldn't have got this infection. Or you admitted all the patients who did not require admission at all to the hospital. The hospital bed is full now. Now imagine this 60-year-old man came to the hospital saying, oh, serious chest pain. Oh, chest pain. We are sorry, we are full up here. You just go home and die at home. Please. You understand? You killed somebody else. That's the reason I'm telling you, you should clearly know who requires admission and who does not require admission. If the decision is wrong, both the way, you're not a safe doctor. Okay, so that's very, very important. You must tell the patient in the exam. Whether the patient asks you this question, doctor, are you going to admit me? Some of the patient may ask you, but sometimes they don't ask you. Even if the patient did not ask you, you must tell the patient whether you're going to admit or not. If you don't mention that, most of the time in the exam, you fail the station. And imagine there's a patient who needed admission for the treatment, but you did not say anything, whether you're going to admit or not going to admit. You didn't mention anything at all. What happened? Pass or fail? Failed, because the examiner will consider that you did not admit. That means not talking about admission or not admission, not talking about it is equal to not admitting. They'll consider that you did not admit, fail the station. So that means very, very clearly you must tell the patient whether you're going to admit or not, whether the patient asks you that question or not. It's your own job. You need to decide yourself whether you're going to tell whether the patient needs admission or not. Now imagine there's a 2-year-old child has got viral diarrhea. You diagnose viral diarrhea to a 2-year-old child, and you decide the child does not need any admission for treatment. Child has no severe dehydration, no other indication for admission. Child is fine otherwise. Child is just got a loose stool. That's it. which you think can be treated at home. And you told the mother that your child has got viral diarrhea. I want one of you to talk to me about the treatment, viral diarrhea. I'm the mother. I'm the mother of this 2-year-old child who was talking. Yeah, pediatrician. You decided not admission, not child is fine, so no need for admission. You decided in your mind, no. Just talk to me. I'm Mrs. Anderson. My child is 2-year-old girl Sarah. You decided, you confirmed that this is viral diarrhea. You did all the tests, whatever it is. You confirmed this is viral diarrhea. Okay, and you know in your mind that this child does not to be admitted. Talk to.
Okay, Mrs. Anderson, whatever you have told me from whatever you have said and from the examination, we have already confirmed that Sarah is suffering from a viral diarrhea. Do you know anything about viral diarrhea?
No.
Basically, it is your child Sarah will be having a lot of loose stools at frequent intervals, and do we have to explain? And I'm just trying to.
You tell me. Do you tell the mother Sarah will be losing a lot of fluid? Do you need a lot of fluids? What did you say? Lot of stool. Don't you think the mother already knows that? That was a symptom the child has got. Mother already knows child has got loose stool. You don't need to say that. So what is the diagnosis? You need to explain. Viral diarrhea. Are you going to explain what is diarrhea to the mother? Or are you going to explain viral? Viral. Yeah, that's what you need to say.
So as Sarah is suffering from viral diarrhea, this condition.
Wait, what you asked me question? Do you know what is viral diarrhea? I said no. First, you tell me what is viral diarrhea.
Viral diarrhea is a condition which is basically self-limiting, and it is caused because of.
Stop. Okay, now you said viral diarrhea is a condition which basically is self-limiting. Is that how you explain a condition? Let me give an example. You know, appendicitis. Do you know what is appendicitis? No. Okay, appendicitis is a condition which we need to treat by an operation. Do you understand?
Yeah.
Is that how you explain a condition? No. Now, tell me, what is viral diarrhea?
It's caused because of. You have to tell because of viruses.
That's what you need to say. Tell me.
So in this condition,
Viral diarrhea.
Caused because of viruses.
What is virus?
Viral infection.
What is viral? It's a kind of bugs. There's a kind of bugs which causes this loose stool. Okay, so there's a virus kind of bugs which causes these loose stools. Do you follow me? Oh, yes. Continue after that.
So are you with me?
Yes.
So what do you say?
You explain the diagnosis. Mother understood the diagnosis. Shh.
So we like to discuss the treatment part. Would you like to know how we'll go forward with this?
Do you need to ask that question? You're wasting time. How much time do we have? Totally 8 minutes. Okay, so everybody knows. Everybody likes to know the treatment anyway. Don't ask, do you want to know how you're going to treat? That's a wasting.
So we directly we would like to discuss the treatment part for this condition. Then we can say that this is.
Just talk to me. You're talking to Mrs. Anderson.
Mrs. Anderson, this is a self-limiting condition.
What?
It is basically subside by itself. But at the same time, you have to take care of the symptoms. That is because in this, she will be as she's losing a lot of loose stools, she will lose water along with.
Wait. Once you say this condition subsides on its own, what are the important thing you have to say?
But we have to be cautious.
One, you give the diagnosis. I already told you, once you give the diagnosis, what is the thing the patient want to know? Is it serious or not? Did you say that? No. Tell me that. This is a viral diarrhea. Explain the diarrhea. What? Then what? Yeah, mother understood. What you tell the mother now?
That's very
This is not a
serious.
very serious condition. This is not a serious condition because it will subside on its own. Is that clear to the mother now? Okay. Okay.
Is it not? It's not a serious condition as it will subside on its own. But at the same time, we have to be cautious as Sarah might be losing a lot of water through the stools. So you have to give her plenty of fluids as and when required, and make sure that she is well hydrated. You can continue with her soft diet, and if at all, the
Which one she did not mention? Okay. Why can't you do all that? Why are you telling me to do that? You give her the fluids.
Because she did not
because
tell about
because as it is not a very serious condition, we will be treating her at home. I mean, we do not.
You will be treating her at home. So you will go to her home and treat her at home.
She doesn't require admission.
First you say that. Okay, so before you talk about the treatment, first you say whether you're going to admit or not. Okay, do you think that makes sense?
Yes.
First you need to say whether you're going to admit or not. Then you tell her, well, what is the treatment? How's the treatment? Okay.
So as it is not a very serious condition, we will be not admitting her in the hospital. So you have to take care of her at home and look at that you provide her with plenty of fluids as and when required, so that she is well hydrated all the time. And along with that, Sarah can continue having her soft diet. As we have to see that she is not, she doesn't lose her calorie. I mean, she doesn't go into calorie. She doesn't lose her calorie, or she's well.
Okay, leave all that. I'll talk in a simple way. What I'm trying to tell you is that how to talk about that treatment, and also important thing is whether they're going to admit or not. And I think somebody asked me when to mention that, whether admit after the treatment or before the treatment. So that's what I'm trying to do. You should know the proper order which you need to say. For example, here I just gave you the viral diarrhea. Mrs. Anderson, your child has got a condition what we call as viral diarrhea. Do you know anything about it? No, doctor. Viral diarrhea means there's some kind of bugs which are causing this infection in the gut. Okay, then these bugs are called virus type of bugs. They cause the infection in the gut, which causes this loose stool. Okay, so do you follow me? Yes, doctor. Now, the good news about this condition is that it is not a serious condition at all, and because it will subside on its own. Do you follow me? Yes, doctor. Now, to treat this condition, we don't need to keep your child, that's Sarah, in the hospital because she can be looked after at home. Is that clear to the mother now? Okay. I'll tell you last time, this is what happened. I told one of the lady doctor to talk to me. I was acting like the same mother. The child has got diarrhea, the viral diarrhea. So she was telling me, hey, Mrs. Anderson, I'm not going to keep your child in the hospital. And I told her, doctor, you keep my child in the hospital. She said, no, I'm not going to keep your child in the hospital. I said, doctor, keep my child in the hospital. She said, no, I'm not going to keep my child in the hospital. I said, doctor, keep my child in the hospital. What is wrong?
Explaining why.
The wordings is not right. Are you going to tell the mother that I'm not going to keep a child in the hospital? What does that mean? Because you did not give me anything, I'm not going to keep. If you pay me something, then I'll keep the child in the hospital. That's what it means. So how do you tell that? This condition, we don't need to admit a child to the hospital for treatment because this condition can be treated at home. This is the way you explain. Okay, so don't simply say, I'm not going to admit you. That sounds like, you don't admit him because maybe he didn't pay you something. Okay, so you should know how to talk. This condition does not need to be admitted to the hospital for treatment. It can be treated at home. First you say that in the treatment. Then you say what is the treatment. As I told you here, I'm talking about viral diarrhea. As I told you, this condition will subside on its own. There's no special treatment to cure this, to treat this condition. But because the child is going to lose a lot of fluid from the body, we need to give her a lot of water, okay, a lot of fluids. So you need to keep giving her a lot of fluids, yeah, like to make a drink, what you call as ORS, if you can get from the pharmacy also. You can make a drink, okay? So, okay, now other things I'm not going to tell you now, I'll come to that later part. So, what my question here was admission or not. Now, let me talk about the admission first. If you're going to admit the patient, you decided, okay, see, we have to admit you to the hospital for the treatment. What are the other important in the patient you want to know if you decide to admit? How long? The most important the patient want to know is how long. Now, imagine you diagnose pneumonia. You decide to admit. All the pneumonia does not need admission. Okay, but imagine the patient is very ill or elderly patient imagine he's a 75-year-old man, pneumonia. Will you admit him? Yes. Imagine you told him we need to admit you to hospital for treatment. And now this 75-year-old man, doctor, how long should I be in the hospital? I want one of you to answer me. How long should I be in the hospital? Mr. Smith, talk to me. Yes, doctor. Yeah.
Mr. Smith, now as we have come to a different diagnosis that you have a serious lung infection,
Okay.
which is known as a pneumonia, and it's quite serious. We need to admit you because on chest X-ray, the picture is not good.
Okay. When I ask a question, please answer to the question. Okay, so don't waste your time. What is my question? How long? These things, have you already told him what is the diagnosis and all that?
Yeah.
You already told him that. You already told him what is the condition. You already told him they're going to admit all these things. My question is simple. How long should I be in the hospital? Answer to the question. Don't waste your time.
Usually this kind of problem it resolves in 5 days. But this is just our careful guess. Maybe this is usually what happens. Maybe if your condition doesn't respond accordingly, maybe we have to keep you for a few days more. But if everything goes according to plan and management, you will be discharged after 5 to 6 days.
Okay. Clear? Yes. You have to clearly mention. Sometimes you do not know the exact number of days. So if it's not days, at least you need to give us some idea how long, approximately. Okay. So, but remember, your answers has to be precise. Okay, don't keep beating on the bush in the exam. You have no time. Okay, it doesn't give a good impression to the examiner either. So answer to the point. His question is simple, doctor, how long shall I be admitted to the hospital? Mr. Smith, usually it takes about a week's time for this condition to subside. So we may usually keep about most of the time we keep the patient up to 5 to 7 days time. So if you recover by the time, yes, we can discharge you. But in case if you don't recover, then we may have to keep you more days in the hospital. Is it clear now? Yes. But I will tell you how somebody else answered to me last time and asked him, is pneumonia. How long should I be admitted? Then he said, it's very difficult to say now how long you should be admitted. But as soon as you're cured, as soon as you recover from this condition, we will discharge you. Right or wrong? Why wrong? Why wrong? Because even the patient, they themselves knows once you recover the condition, you're not going to keep them in the hospital. You don't need to tell them. They know that themselves. Okay, this is not an answer at all. So, is it really important that patient want to know how long should they be in hospital? Yes. Imagine you are this patient. And the doctor told you that you need to be admitted. Do you want to know how long should he be in hospital? Why it is so important you want to know? Imagine you're the lady doctor, come from some other country here. Now you become a patient, got some illness, you become a patient, the doctor told you to admit it. And you got the 2 children also at home. Okay, so who's going to look after the children? Your husband is also a doctor working somewhere. Who's going to look after the children? Somebody has to, you have to bring maybe your parents from home. And you tell them, you tell your parents, You call them and say, the doctor telling me to admitted. Can you please come here and look after my children? And your mother asked, how long should I be there? Oh, that the doctor did not tell us. What will the mother? Can they plan anything? No. So they need to plan their life. So even if you don't know the exact days, at least approximately how long you must mention. Is it days or weeks or whatever it is? Okay. So all of you know how long, how to say that, yeah? So how long will be the admission? And the most important patient want to know is how long will be the admission for? Okay, so sometimes that's like if it's an operation also, they will definitely ask you how long will I be in the hospital. Okay, so that's very important thing. Then other things, of course, how long will it take to subside? Yeah, I'll talk about that. Now between admission and not admission, which is more dangerous? Not admitting. Okay, if you're going to send the patient home, that is more dangerous. Then you're going to be very, very, very careful. Then you need to know what are the things you must say. So now you tell me, imagine you decided not to admit the patient. What are the things you need to tell the patient? No admission. Yeah, you you decided no admission.
Warning signs.
So straight away give the warning signs.
Explain why you didn't admit them.
First you said that admission not required. Admission not required. First you mentioned that. So we don't need to admit to the hospital to treat it for this condition because this can be treated at home. So mention that. Admission not required. Then what's the treatment? What can the treatment at home? I gave a lot of the list of all the treatment. It could be medicine, it could be lifestyle, it could be palliative, it could be physio, it could be it could be any of that. It could be any of those things except which one? Surgery. Surgery cannot be done at home. It could be any of the other treatment. Okay, so you need to say what exactly is the treatment. As I already told you, what is the treatment, which can be medicine, lifestyle, what could be any of those. So what are the other important things what the patient want to know? Okay, before that, what else you tell the patient once you told, okay, admission not required, we can give you this medicine, take this medicine at home. And you must talk about the follow-up. You need to say, okay, take this medicine for this many time, and we will see you again back in our clinic in this day or whatever it is. Okay. So when you talk the follow-up, the two important things you need to say. What are the two important things to say for follow-up? When and where is the follow-up? When is the follow-up and where is the follow-up? When means maybe 2 weeks. Either you go to the GP or you come back to us. So where is the follow-up? Very, very important thing is the follow-up. Why the follow-up is so important? Imagine you diagnose your parent. You kept treating. And you told me, hey, imagine he had COPD, he had chest infection, you gave some antibiotics also. And he improved from the infection. But he still had some cough and all that continuously going on. Do you want to see him again?
Yes.
Why is it so important?
Yes.
Probably a cancer. Maybe you missed it. So at least check whether something you missed. If you are expecting some condition to subside by this time, if the condition did not subside by the time when you expect it to subside, that means, what does that mean? Either this is some complication happened or your diagnosis is wrong. So that means follow-up is very, very, very important. Okay, so what else you tell the patient? If you're not going to admit the patient, follow-up and most important thing is warning signs, or otherwise called as red flag signs. Warning signs or red flag signs. That's very, very, very important to tell the patient. Now, let me just do the same example of viral diarrhea. You decided not to admit the child because child is fine now, except the child has got loose stool. You decide to send the child home, Now, I just want one of you to tell me about the warning signs. Who wants to tell me the warning signs? Warning signs. Okay,
So,
Mrs. Anderson.
Mrs. Anderson.
Wait. He'll raise the hand first.
Oh, no, sorry, go ahead.
He raised the hand. Whoever raised the hand first, I'm giving them a chance.
Well, Mrs. Anderson, before you go, there are some warning signs that you should be aware of. First of all, you should contact us if you see any of these signs on your child, on your, what was the
Sarah.
on your Sarah. One of these things is that if Sarah gets a very high fever, you should call us immediately or bring her to the hospital. Another thing, if you know, I want to say the trigger of the skin, severe dehydration. How do I say it?
She starts vomiting.
No, you don't have to talk about this. There could be other easy signs to talk about. You're talking on the severe dehydration. Which is the most important sign of severe dehydration? Lethargy, or drowsiness.
If you find her more drowsy than usual, please contact us.
Or which is the other way you can easily make out the children?
Sorry?
How can you easily make out the children is very lethargic? How can you make out? Playful. Children are usually very playful. If they're not playing, if they're not active, not playful.
She's not active like she used to be. Contact us. And she's vomiting more than usual. If she's passing stool more than usual, contact us also. That means that she's getting severely dehydrated and she needs to be in the hospital. Is there anything you want to ask me about?
She'd be in the hospital for what?
I'm sorry?
She should be in the hospital for what?
For treatment.
All right. Okay, fine. Good. Now, was it good? How did you do? Yes, mostly, yeah. It was fairly good. So that means you need to tell the patient here, the mother, yeah, what are the signs she should keep an eye on. Now, when you talk of the signs, you don't simply talk of the signs. You should also, the most important thing, what you need to say, these are the signs of which told me at the end. Okay, so you need to keep an eye on your Sarah, because sometimes it can cause severe dehydration, which requires treatment in the hospital. Like if Sarah becomes very drowsy, which is more than normal, or if she's having too much of diarrhea, then more than what is now, or if she becomes very inactive, not playful at all, if that's very lethargic, you must bring her back to the hospital, because as I told you, she needs to be treated in the hospital. So this is how you say. When you give the warning signs, that means there are two things you need to give. We need to mention when you give the warning signs. What are the two things? One is the signs itself. Name the signs. Name it. And name the signs. And then these are the signs of what? Like here in this case, the signs of severe dehydration. Okay, so name the signs and then say, well, these are the signs of these. So for these, if this happens, this is what you must do. That is red flag signs or the warning signs. There's one more important thing I was waiting to hear from you, which you did not tell me. When you said high fever, other things is the drowsiness, lethargy, all these things you told me. What is the other important thing you should say? Whenever you talk about any condition, the treatment, what is the most important patient want to know? How long it will take to subside. That's a very important thing the patient want to know, which I should have written here. After treatment, how long will it take? How long will it take to subside? Very, very, very important the patient want to know. You must tell the patient, yeah, usually it takes this much time for it to subside with the treatment or without treatment, whatever it is. That means the warning sign should include one more thing. What is that? not subsiding by this time. If it did not subside by this time, please come back. If did not subside, yeah, by the expected time, then you say, please come back. Is this something very important? For example, how long do you think the viral diarrhea will take to subside? Maximum 2 weeks. Yeah, so usually this will subside in 10 days to 2 weeks time. But if it does not subside in about 2 weeks time, you must bring Sarah back to the hospital. Why is it so important? If it did not subside in 2 weeks time, what does that mean? That means that is not viral diarrhea. Maybe some other chronic condition which is causing the chronic diarrhea. So all of you understood red flag signs? Now, I want one of you to give me the red flag signs for TIA. If you know what is TIA? Transient ischemic attack. Okay, now, this patient, imagine the 60-year-old man, Mr. Adams, he had a TIA. You decided to send him home. And you decided you will do the investigation as an outpatient. Okay, you want to do some scans or whatever it is later on as an outpatient. But at the moment, you thought he doesn't need to be admitted to the hospital. Okay, you decided to send him home. I want one of you to talk to me about the warning signs. Should you give him the warning signs?
Yes.
Is it important? Very important. Okay. I want one of you to give me the warning signs.
Okay, Mr. Smith, there are some signs that if you have noticed, you have to call immediately the ambulance and come here. Are you following?
Which one? Don't ask, are you following me? What did you didn't say anything? What is that to follow?
First, if you feel a facial weakness, any weakness in your face, any side of your face, if you feel any weakness, you have immediately to call the ambulance and come to the hospital. Are you following?
Yes.
Okay, and then comes the other flag or the red flag, which is slurred speech. If you have any difficulty in your speech, you have to call the ambulance as well. Are you following?
Yes.
Okay, and there is if there any weakness in your arms, that's when you have to call the ambulance. And there is this mnemonic you have to be familiar with so you don't get messed up. It's FAST. The F stands for facial weakness, and A for the arm, and S for the speech, and T for the time for to call the ambulance.
So A for what?
A for the arms, arm weakness.
Don't simply say arm. Arm weakness.
Arm weakness. Yeah.
S for?
For slurred speech.
Yeah.
And T is the time to call an ambulance.
Okay.
Is that okay, Mr. Smith?
What do you mean okay means?
Are you following?
Yes, I'm following.
Any other concerns you want to
No.
Okay, thank you.
Okay. Right to wrong? What he said is right. But remember, just because you said whatever he said is right, it doesn't mean that you will definitely pass. Because some important things, if you don't mention it, then again you're wrong. Whatever you mentioned, some important thing you didn't mention. For example, here, do you think he will call the ambulance next time if he has a slurred speech, facial weakness, arm weakness? Do you think he will call the ambulance? He will not. Why? Because he already had the symptom once, TIA, which result. If you have to diagnose condition TIA, what does that mean? Transient. And all the symptoms because all his symptoms already subsided this time, he was in the same time. So why will he come to the hospital? He thinks he's wasting time. That's what I told you here. You must say signs of what? If it happened next time, all these symptoms, it may not be just a TA like what he had this time. It could be even a serious condition, what you call as stroke, which requires immediate hospital admission. So you must call the ambulance immediately, come to the hospital. So that's how we talk about the warning signs. All of it clear now? So don't simply talk about the warning signs. You must say these are the warning signs of what? Okay, so that's the red flag signs. Now, what is all these things? When you talk about the follow-up, when you talk in the follow-up, you must come back within this time. When you talk in the follow-up or red flag sign, if you have these easy things, you need to come back. What is all these? What is all these? This is safety netting. That is safety netting, which we discussed yesterday in the handout, yeah? This is safety netting. When you're sending the patient home, you're talking in the follow-up and giving the warning signs, red flag signs. That is safety netting. That means you keep the patient within a safety net. You're not telling the patient, okay, just go out. You have to keep the patient within the safety, either come back to us or go to GP. So until he's completely recovered, until you're sure, 100% sure he is recovered, that is safety netting. Now, safety netting has to be talked about whenever you send the patient home. Either it's discharging or not admitting, whichever condition it is, whichever weight, whichever reason it is. When you're sending the patient home, that is discharge, that means after admission, or first time itself, he came to the hospital in the area, but you decided not to admit, send him home, that time also you need to talk about the safety netting. All of you clear with that? Safety netting is the most important thing in the exam. You have to talk about if you're not going to admit or if you're going to discharge. All of you clear with that? Again, as I told you, all the important things to talk about the safety netting. Okay, so where the warning signs and these signs are what? And also, if the condition did not subside by that expected time, you must come back. Or as I told you, the follow-up also is a safety netting. Okay, so we discussed a lot about the treatment, how to talk. So now I give you a structure, as I told you, the history, examination, provisional diagnosis. Most of the time in the exam, you do mention the provisional diagnosis. Sometimes you don't have to mention. You can straight away mention some investigation, then you talk about the definitely diagnosis straight away without initially talking the provisional diagnosis. Not that every station you have to talk about the provisional diagnosis. But I would say most of the time you do talk about the provisional diagnosis and then you talk about the investigation. That's the time exam will give the investigation results. Okay, so then you talk about the definite diagnosis and the treatment. So treatment, remember when you talk about the treatment, just the one more step so that you don't forget is safety netting. Yeah, when you're sending patient home. So that means, yeah, you must keep a structure in your mind. So I want one of you to tell me the structure. Yeah, so without looking at the bird. I want one of you to tell me the structure without looking at the bird. Tell me the structure of the station. The examination management of the patient. What is the structure? Don't look at the bird. Look at me.
Okay, so you take a history, and then you examine the patient, and then
Okay, tell me what happens in the examination.
Okay, in the examination.
What can happen?
Okay, so you look at the news chat.
Mm.
You can look at the news chat, or you can perform a procedure. Oh, sorry.
I said you verbally mention. When you verbally mention, what can happen?
Okay. The examiner can give you the examination findings, or the examiner can tell you to. The examiner can give you the examination findings, or a patient shows you a picture. Okay, or no response, and then in that case you go ahead and want to examine. Sometimes they can tell you to just don't worry, or you eventually do the examination.
Okay. Then what happens after the examination?
Okay, after the examination, you make a provisional diagnosis. After the
tell me what are things you need to tell in the provisional diagnosis. What are things you tell in the provisional diagnosis?
Okay, what are the things you can tell in the provisional? Okay, from the from what you have told me, and from the examination we have I have done, I suspect, or I think that this is what it is. Okay, so that's the provisional diagnosis, and then afterwards you can now carry out your investigations.
What do you do after that? After you name the medical word?
Okay, so after you name the medical word, you explain, and then make sure that patient.
Before explain, do you know about it? You know, I don't know. Then explain. Then explain. Then.
And ask if the person is following. Check for understanding.
Then.
The seriousness.
Okay.
And then what is the seriousness?
Good. Next one. After that.
That's the investigations.
What are things you do in the investigation?
For the investigations, you want to do a blood test. Oh,
Name the investigation.
okay, sorry.
I didn't give you pneumonia here. I just give you in general. Name the investigations. Once you name, what do you do?
You ask. No, once you name, ask them if they're okay with you carrying that out.
No.
Okay, why you're
Check the understanding.
okay?
Name the investigation. Check the understanding. Then ask, is it okay? Don't ask the patient, is it okay? Without even checking whether they understood. First, they should understand. Then you ask, is it okay? That means you take consent. What do you do after that? After the investigation.
And,
What can happen during when you mention the investigation? What can happen? Either, okay, talk, continue from there.
The examiner may show you the reports of the investigation.
Either the examiner may show or may not show. Then what do you do? If the patient examiner shows the report,
Then you tell the patient that from the investigation they have performed on you.
sometimes you show the result to the patient. Explain the result to the patient.
Whatever is normal and what is the pathology.
Yeah. Then tell the patient, see, investigation shows that you do have this condition. That is definitive diagnosis. If the examiner did not give the investigations, if the investigation shows you have this condition, you still talk about definitive diagnosis. What do you do after that?
After that, the treatment methods which
Treatable or not treatable? And what is the treatment? What is the most important in the treatment? Admission or not admission? Okay. What is the other important thing?
the method which you use.
Not admitting the patient. The most important thing, safety netting. And which one do you think the people usually forget of all these things? Of all these things, which are the ones people usually forget? The most thing people forget is examining, investigation, and the safety netting. And I've seen, and I know, yeah, I keep seeing all the people's mark sheet. Okay, remember, usually people forget is either the examination or the investigation. They straight away talk about the diagnosis without even talking about the investigation. Okay, or the safety netting. Don't ever forget that. That's why I even put a circle there and I told you. These are the ones usually people forget. Don't ever forget those things. There's one more important thing which we did not talk about in the treatment, which I told yesterday, or maybe, I think yesterday. What is the most important thing once we talk about the treatment, which I told yesterday actually? Understanding and consent. Consent. Yeah, we didn't talk about yet. Consent means, is it okay, or how does it? What do you think about it? Is it all right? Is it okay with you? Is it all right with you? Okay, so what do you think about this? How do you feel about this? Okay, so consent is very, very, very important. That means you must involve the patient in the treatment. If the patient has to take a decision for the treatment, not you. Okay, so I finished talking about this structure here. Was it helpful? I think we need to take a break. When we come back, what you're going to learn is how to take history. Okay, so then later on after that, how to break a bad news in the counseling and everything. We'll take a 15 minutes coffee break. Then we'll continue.